everyone, and welcome to the Stony Brook Primary Care Track. My name is Dr. Sneha Srivastav, and I'm the Program Director for the Primary Care Track and the Associate Program Director for the Categorical Track at Stony Brook Medicine. Thank you so much for clicking on our video. Over the next few minutes, I will highlight the special features of our program and share how we prepare our residents to become strong general internists. And if you still have questions after you watch this video and review our website, please feel free to email me at the emails below. Okay, let's get started. So why should you consider a primary care track? The primary care track is meant to prepare residents for a career in general internal medicine, particularly in an outpatient setting. PC residents get all the opportunities that categorical residents get, plus more. I always like to think of PC track as a categorical track plus. As a part of a PC track, we have a longitudinal primary care and a biosocial curriculum that runs throughout the year each year. We also offer primary care and ambulatory clinical experiences. We do a ton of community service. We actually have a longitudinal GIM mentorship program across all 3 years, and of course, a scholarship program embedded within the primary care track. So I like to think of the primary care track as a categorical plus more.
The next special feature includes our biopsychosocial curriculum, which runs over 4 weeks during the intern year. Some workshops that the residents go through include helping vulnerable populations and managing social determinants of health, a variety of topics within mental health and addiction medicine. We also talk about issues within end-of-life care, advocacy, and also have the residents go through a variety of communication workshops so that they can practice motivational interviewing skills and also screen for health literacy and how they can tailor their conversations with their patients. Further, during this block, there are a variety of workshops around physician wellness and resilience. A lot of reflection goes in these workshops so that we can help residents avoid and prevent burnout. The next special feature of our program are the primary care clinical experiences. And you have 4 weeks during the intern year, and during those 4 weeks, that's when the biopsychosocial curriculum is also rolled out. And then during your second and third year, you have 8 weeks in each of those years for these rotations. During these weeks, residents have extra continuity clinic. They work with primary care providers in the community so they can understand what it's like to practice in a more private setting and maybe not necessarily academic primary care. We also have sports medicine, pain management, dermatology, some women and men's health clinical experiences, weight management, mental health, lifestyle medicine, where we work with lifestyle specialists, in addition to having experiences around acupuncture and shared medical visits. They also learn how to care for other vulnerable populations, such as those who have been incarcerated and go through the medical unit at the county jail. And the residents also have plenty of opportunity to go through all the other medical subspecialties, such as like endocrine, rheumatology, infectious disease, and etc. All of these rotations are tailored to the resident's interests. So if a resident has more interest in, the weight management, we had a resident who actually took their obesity medicine boards after going through our training. So they spent more time within the bariatric center. I had another that had a strong interest with mental health and addiction. So they spent more time with the psychiatry department to learn those skills. So these weeks are, again, dependent on what the residents are interested in. I work very closely with them to build that schedule, and we will adjust it depending on their own personal goals and how we can help prepare them for their next steps in their future. Another important aspect of our program is our value in advocacy and community outreach. As a primary care group, we try to do 1 community service project a year, and some examples of this include giving educational talks in a variety of venues like local schools, local library, and also even the local mall. We also try to raise funds for a variety of charities or even participate in some food drives. And these projects are completely decided by the residents. At the beginning of each academic year, we vote on a variety of activities, and we together make sure that we do at least 1 per year, and if not, several others. Lastly, I think one of the biggest strengths for our program is our overall GIM mentorship. So when a intern matches into my program, I ask them about their personal and scholarly interests, and I will pair them with a GIM mentor from the very beginning. And I ask mentors to meet with the residents throughout the year, at least twice a year, and I also try to assign the mentors with primary care residents on their PC block so they can also work with each other clinically and give each other feedback in that way. Through the mentorship, residents have been able to complete a variety of scholarly projects, QI projects. They've even been able to present at a variety of conferences, including SGIM and ACP, and even winning awards. So it's really, just a great tight-knit family where we try to help each other on the next steps, and the residents have really gotten to know our faculty very well so that they can help prepare themselves for the next steps in the career.
Our primary care track residents are the leaders of tomorrow, and to better train our future leaders, research and scholarship is an integral part of the primary care track training. We mentor our residents to conduct research in primary care from idea to publishing. Our current ongoing projects for this academic year, which our internal medicine primary care track residents are leading, include a substance abuse curriculum, lifestyle medicine for an internist, primary care for LGBTQ+, and lipidology for internal medicine residents.
Leslie, just to share, where do our primary care graduates go once they complete our program? We've had some very smart and talented residents come through our program. So they've actually stayed on as chief medical residents, also have stayed within general medicine, both in academic and private primary care. Some have focused on inpatient medicine, and they are hospitalists in a variety of different institutions. Some have also been part of the public health sector, and they actually work for the Department of Health. And many of our graduates also go through fellowships, some a little bit more GIM focused, such as a full GIM fellowship, geriatrics, preventive medicine, and global health. And others have also completed subspecialty fellowships, such as endocrinology, rheumatology, ID, and even gastroenterology. If you'd like to see a bit of a list of our graduates and where they've gone, that QR code will bring you to a page about the Stony Brook PC Track Alumni Network. And also from that page, you'll learn about what our alums had to say about the primary care track and how we help them to get to their next career steps. So at this point, you might be thinking, wow, the primary care track sounds great, but I'm not quite sure about a career in primary care. Should I still apply? If you're really strongly thinking about a career in general internal medicine and primary care, we absolutely still encourage you to apply. But please realize that going through a primary care track does not prevent you from exploring other avenues within internal medicine. Our goal is to give you the breadth of experiences so you can decide what your next steps will be, and we will help you get there no matter what. So if you want to learn more about internal medicine primary care tracks, at that QR code is a free resource that was created by primary care directors like myself through our National Program Directors Organization. In this document, you'll learn about why you should think about these PC tracks, why a career in primary care, and also some frequently asked questions when it comes to applying to a primary care track. So if you plan on applying to our primary care track, please be aware that we are a separate ERAS and NRMP number. It's circled right there. So if you would like to apply to us, please make sure we're in the specific number. You can apply to both of our programs if you are interested and curious about both the categorical and primary care track. And again, if you'd like to learn more about us, the QR code there, that's to our direct website. You can always email me. And if you end up interviewing with us and you want to add the primary care track to your application, please also reach out to me because I want to make sure that we can touch base and have all of your questions answered. Thank you so much for taking time out to learn more about us. If you still have questions, please check out our program website and follow us on Twitter and Instagram. I wish you the best of luck on this interview season. I look forward to meeting many of you in the near future, and I hope that you'll be able to join our little family within a larger family. Have a great day, and we'll see you soon. Take care.